Hi, I'm Geri Riehl, and I'm here to guide you through this video on reflexology. This video is intended for individuals who want to help their family or friends, or for massage therapists who want to incorporate reflexology into their current practice. If you want to call yourself a reflexologist and practice reflexology for a fee, we recommend that you take a live training. This video covers 8 lessons. The first lesson covers the history of reflexology. Lesson 2 covers working the 10 zones. Lesson 3 shows how to work the organ reflexes in the feet, and Lesson 4 shows how to work the gland reflexes. In Lesson 5, you'll learn a basic foot massage with your client in the prone position. Lesson 6 begins the hand reflexology lessons and covers working the 10 zones and warming up the hand. Lesson 7 covers working the organ reflexes on the hands, and Lesson 8 covers the gland reflexes. After watching this video, you should have a good idea of how to stimulate the various reflexes and be able to give a relaxing foot and hand massage that incorporates reflexology. Let's begin. Lesson 1, History. Most primitive societies practice some form of reflexology. Tomb paintings from 2500 BC show ancient physicians massaging the feet of their patients. The ancient Chinese Taoists also record the use of acupressure points on the feet to cure disease. In 1890, Sir Henry Head, a London MD, found that certain areas of hypersensitive skin were associated with diseased organs. He published his discoveries about the correspondence between spinal segments, skin sensitivity, and internal organs.
The bladder can be excited into action by stimulating the soles of the feet.
In Germany, in the early 1900s, Dr. Alphonse Cornelius developed a technique called reflex massage. By trying to cure his own disease, he discovered that by applying pressure to sensitive areas of his body, that his health improved and his pain became less and eventually disappeared. In the U.S., Dr. Fitzgerald, head of the Ear, Nose, and Throat Unit at St. Francis Hospital in Connecticut, and his friend Dr. Bowers were making similar discoveries about the use of these reflex points. In 1917, they published a book called Zone Therapy. This book shows that each part of the body that has a reflex relationship lies within 10 longitudinal channels or zones. Later, Eunice Ingham combined zone therapy with compression massage on the feet and published a book in 1938 which developed the prototype for modern reflexology. No one is really sure how reflexology works. We do know that there are thousands of nerves in the feet, and that this may have something to do with its effectiveness. Traditionally, reflexology's benefits are thought to occur through the clearing of energy lines and increasing blood and lymph flow to the reflex area. The important thing is not how reflexology works, but that it does. Reflexology is a great way to help someone heal without being invasive. The client can be clothed and the work can be done in a chair, on the couch, or on a massage table. In this video, we'll show the work on a massage table. If you don't have a massage table, an easy alternative is for the receiver to lay on the bed with their feet off the edge. Position yourself in a chair next to their feet. Traditionally, reflexologists have their clients laying in a comfortable recliner chair with the reflexologist in another chair near their feet. The key is that both the receiver and the giver be comfortable. The idea that the giver be comfortable is important. Being comfortable means not leaning forward and putting a strain on your back, not pushing so deep that your thumbs hurt, and not hunching your shoulders up around your ears. If reflexology is not easy and comfortable to give, you are not going to want to spend very much time doing the work, and you may be surprised to realize that the receiver will be able to feel if you are stressed. It will be transmitted in the way that you touch. In terms of technique, there are only 2 guidelines to remember. The first is that you don't hurt yourself. This means keeping the pressure appropriate and pushing more with the tip of your thumb than the pad. The second is that you make your work rhythmic and slow. This will activate the receiver's parasympathetic nervous system and will put them into a deep state of relaxation. Before we go on to the next lesson, here's a short quiz. What country has tomb paintings of ancient reflexologists? A, China, B, India, C, Greece, D, Egypt. The correct answer is D, Egypt. Who developed the prototype for modern reflexology? A. Dr. Alphonse Cornelius. B. Eunice Ingham. C. Dr. Fitzgerald. D. Dr. Bowers. The correct answer is B. Eunice Ingham. Now let's learn some techniques. Lesson 2. The general sequence. The feet mirror the entire body. By stimulating points on the feet, we can increase blood flow and normalize tissue function in other parts of the body. In this lesson, we'll work the 10 zones. Later in Lesson 3, we'll work individual reflexes. Get a partner, put some relaxing music on, and find a position where you can sit and reach the feet comfortably. The first step in working on the feet is to perform a general warm-up. Put the heel of each palm just under the ankle joint and rock the foot from side to side. We like to call this the foot boogie. Move out the foot, performing the technique. When you reach the toes, start again. Find a pace that's comfortable for you and your partner. Next, put your palm under the ankle and use your other hand to pump the foot pad. This should be enough pressure that your partner's whole body moves. Again, find a speed and a rhythm that feels natural and easy. Let your own body be relaxed while doing this. This is called the foot pump, and this stimulates the lymphatic system. For the final foot techniques, take both hands and grasp the arch of the foot. Then twist each hand in separate directions. Move up the arch towards the toes. The arch reflexes the spine, so this is called the spinal twist. Now perform these same techniques to the other foot. After the feet are warmed up, move on to the next set of routines. Working the zones. A general way to work the feet is to follow the 10 zones. We'll start with the first zone and work from the big toe down to the heel. Apply steady pressure into each area for a few seconds and then move down. Another common way to work the feet is to use the thumb walking technique. This is done by walking the thumb up the zone like this. I prefer to just massage from the toes down. Sometimes your thumbs may get tired. In this case, you can apply pressure with your knuckle. You can perform the whole zone treatment this way. Okay, now we'll show the other 4 zones. The next zone starts at the second toe. Massage down this line to the heel. While you are performing this work, you will still want to be sensitive of areas of tenderness and stop and work on those areas a little more. Don't press so hard as to cause your client intense pain. The person receiving should be able to receive your pressure while still staying relaxed. It is okay for there to be some soreness in some spots. Just keep the level of discomfort at a tolerable level. To work the third zone, start from the third toe and work down this line. Remember to keep the rhythm steady and stay relaxed in your body, shoulders down, not leaning forward. You should enjoy this as well as your partner. To work the fourth zone, start from the fourth toe and work down. Remember not to injure yourself while you work. Don't push harder than you can, even if the receiver asks you to go deeper. Try using your knuckles instead, but realize that the pressure doesn't have to be deep to be effective. For the last zone, work down from the little toe. While performing the session, try to keep talking to a minimum and allow yourself to enter a state of relaxation along with the receiver. After this zone is complete, you'll perform the same routine to the other foot. Lesson 3. Working the organs. The bottoms of the feet reflect the entire body. Each organ, gland, and body part can be affected by working their corresponding reflexes on the feet. By working these reflexes, blood supply is increased and tissue function is normalized. To start, we'll need to get some landmarks. The base of the foot pad is called the diaphragm line. Everything above it relates to the chest and above. The left foot relates to the left side of the body. The right foot relates to the right side. The left lung is mirrored in the foot here, and the right lung here. The heart is reflexed in the foot here. Below the diaphragm line, the stomach is reflexed in this area, and the liver here. Notice how the feet roughly mirror the relationship of the organs in the body. Another landmark is the waistline. The colon and small intestines are just below this line and are mirrored in the feet here. The kidneys are located here, with the 2 adrenal glands sitting just above them, and their connection to the bladder below. The spleen is located here. And here are the other organs all together. Now let's do some work on a few of these organs. First, we'll work on the lungs. Use your thumbs to massage into the area of the foot pad on the left foot. This is a good reflex to stimulate for asthma sufferers. Remember that if your thumbs get tired, you can use your knuckle. When you find a tender spot, stop and hold. After you are done here, work on the other foot in the same area for the right lung reflexes. Now we'll work on the heart, located within the lung reflex area on the left foot. Use your thumb to stimulate the heart reflex. Work the area and ask your partner to tell you when you hit a tender spot. Working on the stomach reflexes can be helpful for digestive problems. Use your left thumb to work into the stomach reflex area. Keep your body relaxed while you do this. When you find a sore spot, work into that area a little deeper. These are the areas that will benefit your partner the most. If your thumb gets tired, you can switch to using your knuckle. For constipation or diarrhea, work the colon reflexes. Here I am working the left foot across the transverse colon. Now down the descending colon and across the sigmoid colon. Perform the same work on the right foot for the right side of the colon. The small intestine is the squiggly line next to the colon. Work this reflex by working on both feet in this location. The liver reflex is located on the right foot here. Work the liver reflex with your thumb on the right foot. Find the kidney by looking at the chart and working the correct area yourself. You'll want to work both feet in the same location for the kidneys. By studying any reflexology chart, you should now be able to work on all the organs in the body. You have been stimulating points on the feet to reflex the body. To make the work even more powerful, you can touch the referral area with one hand while you stimulate the reflexes on the feet. For example, if someone has indigestion, diarrhea, or constipation, you can stimulate the small intestines and colon reflexes on the feet while your other hand rests over the belly. While you do this, ask your client to breathe into their belly, and if you like, ask them to picture a golden light in their belly. As they do this, you should send loving thoughts into the area that you are touching. The contact on the belly is gentle, just enough to help the client bring their awareness to the area. Here are the liver reflexes on the feet and the hand position on the belly over the liver. Hold this position for at least 1 minute or so that your client will receive the full benefit of your work. It also usually takes a minute for the receiver's awareness to make the shift in their body. Here is the hand position for the stomach. This is a powerful way to integrate the reflexology work while directly connecting to the reflex areas. Before we go on to the next lesson, here's a short quiz. The stomach reflex is located where? A, B, C, or D? The correct answer is B. Next question. The foot pad reflexes. A, the spleen, B, the colon, C, the lungs, D, the liver. The correct answer is C. Lesson 4, Working with the Glands. Glands are vital to our health and control our bodies through their chemical messages. The following gland routine will help to balance the immune system and normalize body functions. It is great for people who are stressed out or just not feeling good. We will address 6 glands in this lesson. The pineal gland is reflexed here. The pituitary gland is here. The big toe reflexes the head. The thyroid gland is located in the neck and is reflexed here on the foot. The thymus is located here. The pancreas here. The adrenal glands sit atop each kidney and are mirrored in the feet here. To work the pineal gland, search for the place of maximum tenderness on the upper part of the big toe. This spot may be sensitive. Apply steady pressure and hold for at least 30 seconds. Next, move toward the ankle to find the pituitary gland reflex. Apply pressure here when you find the most tender spot. These 2 glands are the master glands that control many body functions. The next gland we'll work on is the thyroid gland. To work this gland, use your thumb to apply pressure to this area. This gland controls our growth as well as our metabolism. Next, move to the location of the thymus gland. Apply pressure here for at least 1 minute. The thymus stimulates white blood cell production. The pancreas reflexes are located here. Apply pressure with your thumb in this area. The pancreas controls the rate of metabolism for most carbohydrates. The last gland we'll work on are the adrenal glands. They are located just above each kidney. Work on the left adrenal gland by using your right thumb to press into this area. The adrenal glands secrete corticosteroids and other hormones. Now work all these gland reflexes on the other foot. I'm sure you'll find that working the gland reflexes makes the receiver feel wonderful. Touch is a powerful way to communicate. The quality of your touch communicates not only your comfort level, but also your intention. Intending to send loving energy to your clients is as important as performing the techniques correctly. This means that when you are working on the pituitary reflexes, use your intention to send loving thoughts into the area of your client's head. If it helps you, you can picture golden light around the client's head. To take it one step further, you can ask your client to see a golden light around each of the reflex areas that you are working on. Our thoughts are powerful and their effect upon the body is real. Reflexology can be done on the hands or the feet. What we learn for the feet can be applied to the hands. The hands reflect acute or short-term dysfunction. This means less than 2 months. The feet reflect long-term stress. To get a full treatment, work on the reflexes in both the feet and the hands. Before we move to the next lesson, here's a short quiz. The pineal and pituitary reflexes are located in the A, heel, B, arch, C, little toe, or D, the big toe. The correct answer is D, the big toe. Question 2. The adrenal glands are located near what organ? A, the lungs, B, the kidneys, C, the colon, D, the spleen. The correct answer is B, the kidneys. Lesson 5, General Foot Massage. For this lesson, we'll use some massage cream. Apply a small amount of the cream to the lower leg and foot. Massage in this way for a minute or so. We like performing this work with the receiver face down. Now bend the knee more and use your thumbs to massage the top of the feet. Next, bring the foot down and massage into the bottoms of the feet. You can perform all the same reflexology techniques in this position. In some ways, I find this position is easier because the bottom of the foot is exposed, and it's easier to apply pressure downward using the weight of my body. Here, I'm loosely working the zones. It feels really good to pull out each toe. The toes reflex the sinuses. This is good to do if someone has sinus congestion. Next, I am working around the ankles. These areas reflex the lower belly, the ovaries and uterus, testes and prostate on a man. As a caution, don't work these areas in the first trimester of pregnancy. To complete the work, sweep out the foot and then perform the same techniques to the other foot. Finally, hold both feet and send energy of healing and health into your client. Give thanks and honor the time spent. After you disconnect, you'll want to wash your hands in cold water up to your elbows. This will help you to clear off any excess energy from your hands and is a very important part of the completion. Lesson 6. Working the 10 zones of the hands. Just like the feet, the hands also reflect the 10 zones of the body. To work these zones and reflex the body in a general way, pick up your partner's hand and work from the base of the thumb to the tip. This zone reflexes the most central part of the body. To work the second zone, move to the inside of the thumb and work from the base of the palm out the index finger. The base of the palm reflexes the lower torso, while the fingers reflex the head and shoulders. Now switch hands and use your other hand to work out the middle finger, the third zone. While you are performing this work, you will want to be sensitive of areas of tenderness and stop and work on these areas a little more. Now move to the fourth zone and work out the ring finger. As we get to the fifth zone, we are reflexing the lateral part of the body, the reflex areas for the arm, shoulder, and lateral leg. Now turn the palm over and stretch the back side of the hand using your palms and fingers curled on the underside. Next, pull out each finger, starting with the fifth zone, the pinky finger. Now work the ring finger. To make it easy to give, switch to the other hand and work out the middle finger. Now work from the wrist to the index finger. Finally, work out the thumb. Shake the hand and then make circles with the wrist and then each finger. Stretch out the back side of the palm once again and work out the thumb and pinky together. This should feel really good to the receiver. To complete, sandwich the hand and draw out. There are some discrepancies between various reflexology charts. Sometimes a reflex can be a little to the left or to the right, higher or lower compared to another chart. Instead of declaring one chart wrong, I think these differences point to the truth that reflex points can be general in nature and that the reflex points refer to a general body area rather than pinpoint certain spots. I also believe that there may be some variation in each person. So when you want to work a specific reflex, work where the chart shows the reflex and 1/8 of an inch around the reflex area. When you find the spot of maximum tenderness, focus on it until the soreness diminishes. I would also like to mention that the amount of pressure that you use should be firm enough so that the receiver can feel the pressure, but not so deep that you cause them lasting pain. Mild soreness while applying pressure is okay and often accompanies spots that need to be released. Just make sure that this is a good sore and that the receiver can stay relaxed while you do your work. Lesson 7. In this lesson, we'll work the organ reflexes. The location of the reflexes in the hands are similar to the location in the feet. The thumb side reflexes towards the center of the body, and like the big toe, the thumb reflexes the brain and neck. The left hand reflexes the left side of the body, while the right hand reflexes the right side. The diaphragm line is located here and corresponds to the diaphragm. Everything above this line reflexes the organs above the diaphragm. The lung reflexes are located here. The stomach is mainly reflexed on the left hand here. The spleen is next to it here. The liver is located on the right hand here. The kidneys are located here, and the colon and small intestines are located here. This roughly mirrors the location of the organs in the human body. First, we'll work across the lung reflexes located above the diaphragm line. We'll use the thumb walking technique to make 3 passes across the palm. Inch your way across the palm, applying pressure into the tissues as you go. As you do this, make sure your body is relaxed and at ease. Now find the kidney reflex and use your thumb to stimulate that area. Next, we'll make a pass just below the diaphragm line, reflexing the stomach and spleen. Work these areas for indigestion. If we were working on the right hand, we would be reflexing the liver. Now we'll work the colon reflexes in this area. Working these reflexes is a great way to help people with constipation, diarrhea, or irritable bowel syndrome. Reflexology has a tendency to balance the body and bring it into harmony. Follow the colon around the hand. Now, interlace your fingers like so, and use both thumbs to work the small intestine reflexes. Here are some other reflexes that you can work on. These areas reflex the eyes and ears. The tips of the fingers reflex the head and sinuses. Work these areas for people with headaches and sinus congestion. This should be easy and relaxing. Now perform all the same work on the other hand to give a complete session. Here is a short quiz. According to our chart, the stomach is mainly reflexed on A, the left hand, B, the right hand, C, neither hand, D, both hands. The correct answer is A, the left hand. Question 2. This area reflexes what organ? A, the liver, B, the lungs, C, the colon, D, the brain. The correct answer is C, the colon. Now we'll go on to Lesson 8. Lesson 8. Working the gland reflexes in the hand is a great routine to help reduce stress and bring the receiver into a place of balance. The pituitary and pineal gland are located on the thumb here. These are the master glands that control the other glands. The thyroid gland is located just below the first thumb joint and helps to regulate metabolism. Here is the reflex for the thymus gland. The pancreas helps to balance blood sugar levels and is located here. Just below this reflex are the adrenal reflexes. Note that all the reflexes are on both hands. We'll show the techniques on the client's left hand. First, stimulate the pituitary and pineal glands by applying pressure into the thumb here. Work into the area until you find the point of maximum tenderness, then hold stationary pressure on that area for 30 seconds or more. Now we'll move to the next reflex, the thyroid. It is located just below the joint here. Apply circular thumb motion into this area and then move into stationary pressure. To find the thymus, move directly over to the palm. Apply thumb pressure and hold. Now we'll move down to the adrenal reflex, located here. Remember as you apply pressure to send loving thoughts into the client and keep your own body relaxed and at ease. Next, move up and over for the pancreas reflex. Apply pressure here and breathe. To complete, stretch out the palm, place the hand down. Perform the same routine to the other hand. That completes our presentation on reflexology. After watching this video, you should have a good idea of some of the main organ and gland reflexes on the feet and hands and be able to give a relaxing foot and hand massage that incorporates the 10 zones. Remember that reflexology should be enjoyable and relaxing for both the giver and the receiver. Always come to your sessions with an open heart, and I am sure that you will have great success. Thank you for watching.
Real Bodywork has a complete line of high-quality educational massage videos. Some of our other videos include lymphatic drainage massage, our deep tissue and neuromuscular therapy video set, the myofascial release video set, healing stone massage, polarity therapy, and others. Our website, realbodywork.com, has over 70 pages of information from lymphatic drainage techniques to neuromuscular therapy and trigger points. You can see video clips of various types of massage and learn more about your favorite modalities, or call 888-505-5511.